Emergencies can strike anyone without warning, and quick action can save lives, especially in life-threatening medical situations such as heart attacks. A 52-year-old man suddenly experienced severe chest pain at home, a classic symptom of a heart attack, and collapsed within minutes. His family immediately called emergency services, understanding that every second counted. Recognizing the warning signs early is critical because symptoms like intense chest pressure, shortness of breath, dizziness, nausea, or profuse sweating can appear suddenly and require urgent attention. Paramedics arrived within minutes, starting CPR, monitoring vital signs, and stabilizing him for transport to the hospital. Rapid emergency response dramatically increases survival rates, particularly for cardiac events, because delays can lead to permanent heart damage or death. Once he arrived at the hospital, the cardiac team was fully prepared for emergency intervention, demonstrating the importance of trained professionals ready to act immediately. The patient required emergency surgery to remove a blocked artery, a procedure that needed precision and coordination among cardiologists, surgeons, and support staff. This case emphasizes the critical role of awareness, immediate response, and professional medical care in saving lives. Viewers should understand that learning the basic signs of a heart attack, knowing how to call emergency services, and preparing for medical emergencies can make a life or death difference. Immediate action, preparation, and professional care combine to transform potentially fatal situations into successful outcomes, highlighting the importance of knowledge, readiness, and calm decision-making during emergencies. Following such procedures not only saves lives but also ensures that patients recover more quickly, with reduced complications. Everyone should take note that emergencies do not provide warnings, and understanding proper response can drastically increase survival chances. By raising awareness and acting promptly, individuals can help save lives, making health emergencies manageable rather than tragic. Recognizing heart attack symptoms and responding immediately is critical because every second matters when a person's life is at risk. Heart attacks often start suddenly but can also have subtle early warning signs, and knowing these signs can make the difference between survival and a fatal outcome. Common symptoms include severe chest pain or pressure, discomfort in the arms, neck, jaw, or back, shortness of breath, dizziness, nausea, cold sweat, and feelings of anxiety or impending doom. In many cases, people ignore these warning signs or delay seeking help, which can drastically reduce their chances of survival. In the example of the 52-year-old patient, the first moments after chest pain began were crucial. Recognizing the severity and calling emergency services immediately allowed paramedics to intervene in time. Educating yourself and your family about these symptoms can prevent tragedies and save lives. It is important to remember that not all heart attacks present with the same intensity of symptoms, especially in women, older adults, and people with diabetes, who may experience less typical warning signs. Prompt recognition followed by immediate action, including calling 911, starting basic first aid if trained, and staying calm until help arrives, significantly increases the likelihood of surviving a heart attack. Public health experts emphasize that awareness campaigns, symptom education, and training in emergency response are vital for communities because they reduce response times and improve outcomes. Watching for the early signs and responding without hesitation allows medical teams to provide emergency care faster, which can prevent permanent heart damage, complications, or death. Understanding and acting upon the first indications of a heart attack is not only life-saving for the individual but also ensures that emergency systems can work effectively, giving patients the best chance of recovery. By learning these symptoms, keeping emergency numbers accessible, and preparing mentally to act quickly, viewers can transform potential emergencies into manageable situations where professional care can make a real difference, reinforcing the importance of knowledge, readiness, and rapid response in high-stakes health emergencies. Once emergency services are alerted, the response of paramedics and first responders is a critical factor in determining the patient's outcome, especially during life-threatening events like a heart attack. In the case of the 52-year-old patient, paramedics arrived within minutes of the emergency call, demonstrating the importance of rapid dispatch and professional readiness. Upon arrival, they quickly assessed vital signs, initiated life-saving measures such as CPR when necessary, and administered emergency medications to stabilize the patient. Paramedics also ensured the patient's airway, breathing, and circulation were maintained during transport, continuously monitoring heart rate, blood pressure, and oxygen levels to prevent deterioration. Efficient communication with the receiving hospital is equally important, allowing the emergency department to prepare for immediate intervention. During transport, every movement is calculated, including the use of specialized equipment like defibrillators and oxygen, to maintain the patient's stability and minimize delays. Emergency medical response not only focuses on immediate life-saving procedures but also on creating a seamless handoff to hospital staff, ensuring the patient receives continuous care from the scene to the operating room. Training and protocols followed by paramedics are designed to maximize survival rates, and statistics show that rapid professional intervention significantly reduces mortality in cardiac emergencies. This case highlights the value of understanding how emergency medical systems operate, including the roles of first responders, paramedics, and the coordination with hospital teams. Viewers should recognize that timely action, knowledge of emergency procedures, and confidence to act in critical moments can save lives. Learning basic CPR, staying calm during emergencies, and following instructions from trained professionals ensures that patients receive the fastest possible care. The combination of rapid response, professional expertise, and effective communication is essential in emergencies and demonstrates why early intervention by paramedics is often the deciding factor between survival and fatal outcomes. Understanding this process reinforces the importance of preparation, readiness, and awareness of emergency services for every household and community. Upon arrival at the hospital, every second remains critical in determining the outcome of a heart attack patient, and the efficiency of the emergency department plays a vital role in survival. The patient is immediately assessed by the triage team, who evaluate vital signs, cardiac rhythm, oxygen levels, and overall condition to determine the urgency of intervention. In this case, the cardiac team was already notified by paramedics and was prepared to act instantly, minimizing any delay in treatment. Rapid diagnostic tests, including electrocardiograms and blood work, are performed within minutes to confirm the severity of the heart attack and to identify the blocked artery that requires urgent attention. While the patient is stabilized, hospital staff prepares the operating room and ensures that all surgical equipment, medications, and monitoring devices are ready for emergency cardiac surgery. The coordination between emergency doctors, cardiologists, surgeons, and nurses is crucial, as each step is timed to reduce risk and improve the chance of a successful procedure. Patients in critical condition may receive medications such as blood thinners, pain relief, or clot-dissolving agents while being prepped for surgery, all under constant monitoring to prevent deterioration. Effective communication between paramedics and hospital staff allows for seamless handover, ensuring that life-saving interventions continue without interruption. The preparation process emphasizes the importance of protocol, readiness, and experience, as any delay can lead to complications, including permanent heart damage or fatality. Hospitals equipped for cardiac emergencies follow strict procedures that are designed to stabilize patients quickly and prepare them for surgery efficiently, maximizing survival rates. Viewers should understand that advanced hospital systems, trained personnel, and well-coordinated emergency response are essential components in saving lives during heart attacks. Knowing that emergency departments operate with precision and speed can reassure patients and families, while also highlighting the importance of immediate action and awareness in potentially life-threatening situations. The rapid assessment, triage, and surgical preparation collectively demonstrate why timely hospital intervention is a critical link in the chain of survival during cardiac emergencies. Emergency cardiac surgery is one of the most critical steps in saving the life of a patient experiencing a severe heart attack, and the procedure must be performed with precision, speed, and coordination to prevent permanent heart damage or death. In this case, the blocked artery that caused the heart attack required immediate intervention, and the surgical team worked efficiently to restore blood flow to the heart. Before the operation, the patient is prepared with anesthesia, monitoring devices, and sterile precautions to ensure safety throughout the procedure. During the surgery, cardiologists and surgeons carefully remove or bypass the blockage, often using specialized tools and techniques that are designed to minimize risks and complications. Continuous monitoring of vital signs, heart rhythm, oxygen levels, and blood pressure is maintained to detect and respond to any changes instantly. The surgical team follows strict protocols, coordinating every step from incision to closure to ensure the best possible outcome. Emergency surgeries like this demand experience, precision, and rapid decision-making because delays or errors can lead to irreversible damage or fatality. Post-procedure, patients are immediately transferred to intensive care units where specialized staff continues to monitor recovery, manage medications, and prevent complications. This stage highlights the critical role of advanced medical technology, teamwork, and hospital preparedness in life-saving interventions. Viewers should understand that emergency surgery is not only a technical procedure but a coordinated effort involving multiple professionals whose expertise directly impacts survival. The combination of quick recognition of the heart attack, immediate emergency response, and skilled surgical intervention demonstrates why high-quality medical systems save lives. Public awareness of how emergency surgeries work can encourage preparedness, rapid action, and respect for the critical importance of specialized hospital care. By understanding the process of emergency cardiac surgery, viewers can appreciate the life-saving capabilities of modern medicine and recognize the steps that make a difference between life and death during severe heart attacks. After emergency surgery, the patient's recovery is closely monitored in the intensive care unit, where doctors and nurses ensure vital signs remain stable, medications are administered on schedule, and any complications are addressed immediately, demonstrating the importance of continuous professional care following a life-threatening heart attack. Recovery includes monitoring heart function, managing pain, preventing infections, and gradually reintroducing physical activity under medical supervision, all of which contribute to a safer and faster return to health. In this case, the patient stabilized within hours and began rehabilitation to strengthen the heart and improve overall well-being, highlighting how timely emergency response combined with expert hospital care can transform a critical situation into a positive outcome. For viewers, the key takeaway is that understanding the signs of heart attack, responding immediately by calling emergency services, and ensuring access to trained medical professionals significantly increase the chances of survival. Public health guidance emphasizes that families and communities should be educated about heart attack symptoms, CPR techniques, and emergency numbers, because preparedness directly impacts outcomes in life-threatening situations. Awareness campaigns, training programs, and knowledge of proper emergency procedures empower people to act decisively when seconds matter most, reducing fatalities and preventing long-term health complications. Additionally, adopting a heart-healthy lifestyle, regular checkups, and following medical advice after recovery are crucial steps to prevent future cardiac emergencies. This case also illustrates the importance of modern hospitals equipped with advanced technology, specialized surgical teams, and coordinated emergency response systems that work together seamlessly to save lives. Understanding these processes not only increases public confidence but also encourages viewers to be proactive in emergency preparedness. By recognizing early symptoms, responding quickly, and relying on professional medical care, individuals can drastically improve survival rates, and families can witness recovery instead of tragedy. The combination of rapid recognition, professional intervention, continuous monitoring, and post-surgery care ensures that life-threatening heart attacks are managed effectively, reinforcing the vital role of preparation, education, and timely action in every community.